say I ain't no good, and I'm crazy as a loon. Cause I shave my head in the morning, pick guitar in the afternoon. Just like old Chief and Charlie, I like to lay around in the shade. Well, I ain't got no money, but you better believe I got it made. Cause I ain't asking nobody for nothing if I can't get it on my own. If you don't like the way I'm living, just leave this bald-headed country boy alone.
Thank y'all for tuning into the Josh Terry podcast. I am on location in a place that I didn't think I'd be recording a show. Usually when I go to doctor's offices, it's not because I want to, it's because I have to. And today with me, I got Miss Lynn Brown, who is not only a sponsor on the show, but she is helping me with weight loss and some other issues. So don't tell them all my issues. We'll keep some of that stuff private. What's it called if you can't, you can't disclose somebody's stuff?
It's called confidentiality.
Okay, I thought it was called like HIPAA.
HIPAA.
Okay,
is,
yeah, that's what I was thinking it
HIPAA's
was.
definitely. That's basically the prevention of spreading health information. Obviously, you're going to sign a release form, so you know for to be able to do this on.
Oh,
radio.
absolutely.
So
yeah.
we've got.
I was actually
going to
wonder about that.
Yeah, we'll make sure we got that.
Well, first off, thank you for taking care of me the other day, being a sponsor on the show. This kind of stuff right here is interesting to me because if you knew the people I normally have to talk to, either social media personalities or artists, I usually feel like I'm the smartest person in the room, and that's not a good thing. Like, I don't have the highest IQ level, so being around people that's smarter than me and know some stuff, I think I'll enjoy this.
Well, I don't know if I'm going to say I'm any smarter than you are, but I mean,
Oh,
maybe just a little bit different knowledge base.
No. You don't have to be kind. No, you're definitely a lot smarter than me. Well, first off, tell them the name of your office and all that kind of stuff.
Okay, the name of the office is Your Choice Healthcare in Eastman, and then there's a Your Choice McRae in McRae.
Okay, you want to give them the address and phone number and all that good
Sure.
stuff?
The Your Choice McRae office is at 23 West Martin Luther King Jr. Boulevard, McRae, Georgia. The number is 229-868-2105. It's located right next to Ryle's Drug Store, so on that side street. So if you know where Ryle's is, you're right next. You're looking at it on the side of it.
And for all y'all from Eastman, if you want to know what it's next to.
Okay, Eastman is at 822nd Avenue, Eastman, Georgia. Phone number is 478-559-3154, and we're actually right in front of Scott Holder's building.
There you go.
Yep.
I was going to plug them if you didn't. That's a second family. I love those guys over there.
Yep, they're good folks.
Well, last week I came in here for some other stuff. I have attention deficit disorder, if you can't tell, from everything. And you know what I liked? Y'all did the EKG. Y'all did everything to where when I left here, there's been some doctors. I told y'all I had like a problem with my previous doctor because it just seemed like they shipped me in and shipped me out. I felt like cattle.
Right.
Like they just it's like, hey, what if I'm done did this too long or whatever? Are you gonna do any tests or whatever? So it was I like the fact that y'all kind of went above and beyond right off the bat.
Well, I appreciate that. Well, whenever I started practicing, I had some good advice from my old collaborating doctor, Dr. Lou Munziak, who's went to see Jesus now. But that being said, he was a great mentor. He always said, Lynn, make sure that you get a baseline for people, because you don't ever know what changes. And so it's important to get labs, EKG, especially on certain medications. You want to look for things that may prevent them from taking that medication or not be a good fit. So, you got to pick the best medicine for the patient based on what the patient's symptoms as well as their physical well-being is. So it's a combination that you have to do.
Well, I'm big into, I don't know if you've ever watched this kind of stuff. I don't like opioids, really. It's just, I've seen what it's done to families that have abused them and everything.
Yeah.
And so, I've watched all these documentaries and everything of these doctors that just want the money.
Yeah.
And they push them in and out. And there's something about going to a place and you feel uncomfortable. I guess that's not what this is. And I felt that was really cool. Like it was just something that I wasn't expecting either.
Well, good. And I will say this, there is a place and a time for patients that need pain medication. However, that needs to be monitored closely.
Absolutely.
And that being said, we do have a provider that comes into our office because as a nurse practitioner, I don't write those medications routinely. So, again, that's being monitored. You watch the prescription drug monitoring program in the state of Georgia as well as other states that you look up. All providers have access to that. Drug screens, pill counts, just knowing your patient base to start with, not just taking anybody walking in, I need medication. No, that doesn't work that way.
I was scared to death that's what you was going to think I was doing. I was so scared that when I was like, hey, I don't want to go to this other doctor anymore. But even then, like, if you knew how cautious I was or what I put in my body besides for food, like, my fat ass likes to eat. Like, I'm going to eat. That's my problem. That's why I'm here today and some of the stuff we're going to talk about. But it was even when I was starting to leave and y'all were doing it's giving me the thing to where I'll come back in 30 days.
Right.
And you're like, you're going to do a drug test.
Yes.
And I was like, why are you giving me a drug test? And then you want to explain why?
Yeah, well, certain medications for ADD can be controlled substances, Schedules 2s, 3s, and 4s. Basically, that means you can't get them without a prescription, and they're controlled by the DEA. Well, I like my license. I like my DEA certification. There's certain things you have to do. So we do monitor drug screens routinely. And we actually just basically are making sure that, number one, it's in your system, and number two, there's not something in your system that doesn't need to be in your system. Now, I'm going to say this, and marijuana is marijuana.
I asked her about it right off the bat.
We're not, I mean, that's not such a big deal anymore. I mean, now if you're a truck driver and that's a class 1, you cannot have it. But that being said, we're not so much worried about if you smoke a little weed, versus, you doing meth. That's going to blow your heart up taking Adderall or Vyvanse or whatever and taking meth or cocaine or heroin. No, we're not going that route. We're going to cut it right there. We're going to nip it in the bud.
Since you're the first nurse practitioner I've had on here, let me ask you something. What do you think about, because I am big into this, and I should have said this beforehand. Okay. I am big into microdosing mushrooms and the benefits it has on mental health.
I know little about it. I don't know a lot. I will tell you that. I do know that there's some research on a specific type of mushroom now that saying
it's psilocybin.
That they're saying is seeing some really good results in clinical trials. But I really can't speak to it a lot. But I do know that is a thing going on.
It's
now.
Something that is very hard to get in the medical dose or whatever, however you want to say it, or from a place that you trust, a company that you trust or whatever. Yeah. I just didn't know if that was something that you were.
Yeah, I mean, like I said, I am proactive when it comes to herbal supplements and this, that, and the other. And I do think that whatever you get should be tested.
Yes.
Like third party tested so that it's accurate and it's saying that is actually what's in it, not a bunch of filler or a bunch of bullcrap.
Yeah.
So that being said, yes, but I just don't know enough about the mushrooms. But there are programs that are being studied now. I know with reputable resources and providers that are looking at what can be used for, and I've heard really good results on it.
It is insane. I don't get a chance to do it because I am so, like I said, when it comes to a pill or something, I am so ticky about what I put in my body.
Well, good.
Like
you should be.
I'm scared though. Like I know that I have an addictive personality, so like I don't smoke cigarettes. I've had to cut way back on my alcohol consumption because it just got out of hand with the life I live with the show and everything.
Right.
Because I knew it was getting too far. I'm scared to death to try anything else because I know if I like it, it's over with.
Well, I'm going to be honest with you. I've never smoked marijuana, pot, whatever you want to call it. I mean, I knew that I grew up in a home that my father was an alcoholic. So I know there's addiction issues in my family. I didn't want to chance it. So you see, I'm very cautious about what I put in my body as well.
I grew up in a household with addicts. I didn't touch anything besides alcohol until I was 30 years old. That was the first time. But I have my mental health. I've gone through it and like come to grips with my mental health and everything, and all this kind of stuff, and all the research I've just seen on using it the right way.
Right.
And like everything. It's just, I've got buddies that are veterans that the VA now gives them ketamine treatments.
Yes, I've heard some really good things about the
swear by
ketamine.
it.
And they say it's really good for depression and like
Yeah.
the PTSD kind of thing as well. I think all that goes with that.
Well, just so you know, when y'all do my drug test, then if there's anything that pops up for microdosing mushrooms, which I don't even know if it would.
I don't even know what would show up as a microdosing mushroom.
just-
I'd have to do some research on that
Just
one.
know there's liable to be a little THC and some mushrooms there.
Okay.
If you, I don't want to. She's like, I'm never gonna have you as a client again. But I'm very transparent, and I think that's the only way you stay out of issues with medication.
Right, and I agree with that. And the thing about it is, as a provider, what you tell me is in confidence. Now, that being said, what I'm going to tell you back is still in confidence. But, you know, I'm going to say, okay, well, you might not want to do that. Or, you know, that's all right in moderation. Or let's talk about why you're doing that.
Yeah.
You know, that's what the whole client, patient, nurse, practitioner, doctor, provider, whatever. I am not a doctor, just so you know. But the provider, you know, the relationship that we have is to build trust, gain confidence in each other, and help each other. Sometimes I'm just an ear for people to talk to. I mean, yes, I refill medications, but sometimes as they come in and they just sit down and they're overwhelmed and they talk to me, sometimes I'm just a sounding board. Sometimes I can give them some advice, you know, personally. Hey, this is what you might want to do, you know, or have you thought about this, or maybe you need this. I mean, you know, just talking about counseling, or, you know, or there's lots of things that makes up the holistic approach to patient care, which is what I try to promote, is the holistic approach, because it's our mind, body, spirit. It's not just the physical part of it, it's all of it. And if your heart and everything's not with, you know, it's all got to match. It's all got to flow together. So when you're hurting in the heart, that makes your physical and mental capacities, you know, they're hurting too. Okay.
You better watch out for you turn to my therapist, because you saying you'll be an ear, I'll be in here every other day. You will think I'm a hypochondriac. So
you just
bad.
need that counseling, don't you?
It's insane though, because the previous doctor I had for weight loss, when I tell you, you come in, you get weighed, you go to a room, they check your blood pressure. You don't even see the doctor or anybody really, like not a nurse practitioner even. You see a nurse, and they bring you your bag of Adipex, and then they scoot you on your way.
Right.
And it's just like, I'll tell you, and I'll tell anybody, the reason why I wanted to change doctors is there's somebody close in my life that's about to be an RN. And they were like, hey, are you still taking Adipex? And I've been taking it off and on for like 5 years.
Right.
And they were like, you need to not only get your heart checked, but if they're not testing you for anything or like doing blood work or nothing like that, you could have done some serious damage by taking Adipex that long. Because I guess it's supposed to be a short-term thing.
Adipex should be given in shorter periods of time, and we actually have several different medications in that class of medicine that we can use, because Adipex, your body does get used to it. It can increase your heart rate and your blood pressure. Let me give you a personal experience.
Okay.
I'm 53 now.
Okay.
Everybody know I'm not
I did not even guess in that. Good job.
Well, thank you. I mean, I feel pretty good to be as my age, but I've taken Adipex or phentermine over the years for the help with weight. And that being said, about 5 or 6 years ago, I've been here almost 7 years now. It was in the early first couple years of the practice. I had taken I had phentermine to help with some weight, and I had taken one that day, that morning, and never had any problem at all before. Well, I went to lunch, come back from lunch, and I didn't eat my lunch. I just felt really bad, and I walked in. I told my husband, and he just happened to be with me that afternoon, and he brought me back to the office, and I said, I don't feel right. Something feels real funny. So my heart was racing. So I got in here, I saw my nurse. I said, will you please check my blood pressure? My blood pressure was all over the place. I said, so she's like, Lynn, it's not right. So we did an EKG. My heart rate was over 200.
Ooh.
So that being said, that scared the hell out of me.
I bet it did.
Yeah, I mean, as a provider, I'm not going to an emergency room, okay? So,
we went to the hospitals around here anyway.
Just in general. Well, I mean, we got some good and bad and ugly and all everything. But that being said, I walked over into the ER with my EKG in my hand from the office and said, I'm in tachycardia. I need some help. And so we got in. I will say this: Dodge took care of me, checked me out. And it was the phentermine that caused it. However, I do have a family history of high heart rate, which never usually happens in the late 40s. Well, guess what? I was in my late 40s.
Yeah.
Since then, I don't drink caffeine. I don't touch any phentermine. I don't do any stimulant of any kind, just because I don't want to ever feel like that again. Well,
I just heard more about an experience with Adipex or phentermine from you now than I've done in the past 3 years.
Oh, wow.
Of what it could do. Like, it's one thing if you give me a pamphlet. It's one thing if you send me with something, right?
Right.
But actually hearing, like, this is how you might feel. If this is how you might feel, back off of it.
Exactly.
I got real scared. And then I was like, you know what? I'm going to just go cold turkey.
Right.
Well, what happened when I went cold turkey over the past 2 months? I blew up. And then, you know, this might be TMI for anybody, or for especially when you're sitting talking to a nurse practitioner. But when I'm in Nashville and I'm recording shows, my schedule is hectic.
Right.
And I've took Adderall before, like how you were supposed to.
Right.
And it just work was better, focus was better. I mean, everything was better for me, and my weight seemed to stay down. Like, I've always battled my weight, but it seemed to stay down then. So, like, when I was off of the Adipex for the last 2 months, somebody gave me an Adderall that they had a prescription for while we was there. And I got everything done that day that I needed to get done. And I was like, this is my sign right here. I'm not going back on Adipex. I'm going to go see a doctor. And it just so happens at the same time that somebody introduced you to me. Correct. And we came on as a sponsor of the show. And I was like, well, she seems so nice. And I followed all your stuff on Facebook. Well, awesome. And I saw how even your clients were talking about you, how people were just raving about you and everything. So I was like, I'm just going to be real with her and tell her I know that I have ADHD and I want to fix that, but I also want to work on my weight because I battle with it so much. Right. So like it was like a vote of confidence coming in here already before I even knew you. Well,
that's wonderful, and I appreciate that very much. But as a provider, I do need to make sure I tell you that. Never take a medication that's not prescribed.
I know. That's why I said she's gonna get on to me.
I'm gonna get you. But that being said, you know that the medication has helped you in the past, and it works for you. It helps you focus. That is the whole point of the medication. There are non-stimulants and stimulants that we can take. And obviously, we have to find the best fit for each person. Now, before you left the office, you had an EKG. So I made sure that there was no heart issues, obviously.
I was super surprised by that.
And the next thing was we're set up for labs when you come back before your next month appointment. Because, number one, I'm going to follow up with you. I'm going to check that kidney, that liver, that thyroid. You know, anything that may have a problem with medications, and also I do look at vitamin D levels, B12 levels, because energy, how you eat, how you feel, you eat a lot of times to feel better, to get energy. So if you're naturally depleted of your vitamins and minerals and your thyroid may be off, things like that, I want to make sure that you've got the optimal levels. So we kind of get you in a good place where your medication works the best for you. And of course, hey, I might have found that you don't need to take this or that or the other because of your kidney functions may be off or your liver functions may be off. I mean, you did say you used to drink alcohol a good bit. Well, that being said, that really can throw off your liver. Well, a lot of medications are metabolized in the liver, so we don't want to overrun that liver. We want to keep it healthy. So that's why I do what I do, to find out what, where a good baseline is. And then we follow up. Once you're at a good dose, well, we may move out to 3 months on a routine basis and things like that. But as far as, medications go, but my goal is to, I get you in, see what's going on, get your health, get you started in the right direction, and then just kind of let you and give you the information and the tools that you need to do better with what you're doing.
That is so comforting. Like seriously, like it is. I wasn't trying to bash the other people, but now hearing how much you go about what you do, you just know that like you have to find a good doctor for this stuff, or a good nurse practitioner, a good practice.
Yes.
You have to find someone that is looking out for you, not treating you just as a paycheck.
Right. I mean, obviously we are here to make money.
Oh yeah, everybody is.
But if you do not have a calling or want to help somebody, this is not the right place for you to be.
Yeah.
Because you can make a lot of money, but you can go to jail for making a lot of money too.
Yeah.
So let's do it the right way.
Yeah. I don't know if you've seen that thing on Hulu called Dope Sick.
As a matter of fact, I was talking about it earlier with somebody.
Oh my God. And then one got released today on Netflix that I am so excited about.
Yeah.
It's called Painkiller. But it's a limited series. It's a movie, and it's about the Sattler family.
Oh, okay, yeah.
I mean, it just came, like, I saw it before I came here, and I knew if I started it, I was going to be rushing back home, and I can't rush to get back home today. It's just, you don't find people that care about you that way.
Right.
Like, you have to.
Well, even in Dope Sick, if I remember right, that was where Michael Keaton was a physician, right?
Yeah, so good.
And he wound up, getting hooked on the medication because, and he didn't realize how serious that medication was until he actually got hooked on it. I mean, and the manufacturers were obviously not telling the truth about the addiction issues, which, as a good provider, there's medications that we do prescribe that we have to tell, hey, we need to step this up or step it down. You don't want to just quit cold turkey because it can make you have withdrawals, this, that, and other. And I mean, that can be anything from an antidepressant to the phentermine to the Adderall. You want to guide people in the right direction, no matter what medicine. Even blood pressure medicine, you want to make sure that they're taking it appropriately.
Yeah. Like I said, you just give way more information.
Yeah.
That's comforting. Yeah. Like, to somebody who's scared of pills or scared of going to the doctor, I know that is a big thing for a lot of people, and we joke about it, is I don't know that something's wrong with me if I don't go to the doctor.
Correct.
Yeah, because you're scared of what's going to happen, and you're scared how you're going to be treated and what they're going to say.
Yeah.
Hearing somebody like you explain stuff the way you do and the way you're going about it, there's a comfort level to there that even if you wasn't a sponsor on this show and I've met you and you talk to me this way, I'd be like, this is going to be where I go from now on for all my health concerns. Great.
Well, and that's what we want, people to feel comfortable, to feel that they can approach me. And Lynn Rogers is the other nurse practitioner in my practice in McRae. She's very approachable as well. We care about our folks. We know, we not only know them in the community, we know them here as well, or we get to know them, So that being said, and our staff tries to make sure that we take care of our patients. We do try to follow up on like prior approvals, if we're referring out, different things like that. The art of the practice and what keeps the heartbeat going then is all of us working together, not just the providers, but the staff working together to make sure that the patient's experience is as smooth as possible. Now, that being said, yeah, we have hiccups and bumps. I mean, everybody does, but the goal is to make sure that the patients have what they need. And I love puzzles, so if you come in here and tell me da 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 da, I'm going to start piecing things together. Sometimes it's just in the conversation that we're having that I can pick up on something. Like, for instance, you came in, you saw me a month or two ago, and you came back in today, and you just happened to say, well, I've did this, and this, but this is going on, and you just may be thinking we're having a casual conversation, but you're taking listening notes to what you're telling me, and I'm sitting here thinking, well, and I start digging in the chart a little bit for a minute and just say, well, we put you on a new medication, or we did this, or something that triggers a thought process in my brain. And I'm going to be like, oh, wait a minute, we need to talk about that. So, and sometimes that takes longer with some patients than others. Sometimes they don't really have an issue. So, that being said, we do spend time. We try not to spend, a long time, but we do try to spend to get to know you, find out what's going on, build the trust, and, feel like you're able to talk to us. And then we just listen and pick up on things that, okay, that's triggering something. So let's talk about that for a minute. And that's important. I can find out a lot of things just by you telling me, not just my physical exam, but by you telling me things as well.
1 out of 3 practices has done. Like, you're my third. You're the third people that I've gone to whether it was for weight loss or ADHD.
Okay.
You're the first ones that have treated it like that.
Right.
I'm amazed.
Well, I am a nurse practitioner. Nurses, so I'm a professional registered nurse before I became a nurse practitioner. Mm-hmm. So nurses have a more holistic approach than a medical doctor does, or even a physician's assistant. So basically, we're looking at what our experience has shown us over the years in whatever hospital, nursing home, wherever we worked. We have all that experience, or at least I did, before I went to nurse practitioner school. Worked in the ER, ICU. That personal touch, whether it's a bedside nurse or a provider, is what makes our practice more unique, in that we want the holistic approach, and we try to make sure that it's everything's kind of addressed, whether it's just talking to you to find out if there's how your day is.
So much more
sometimes.
sincere.
Yeah, and that's the way nurses are.
Yeah.
We're the number one trusted profession in the world, number one. So, and that's what I've done all my life. So, it's something that kind of comes natural at this point.
Well, you do a hell of a job of it.
Well, I appreciate
it's
that.
obvious. And I'll even say this: I didn't know what to expect coming in here to do the show.
Right.
I didn't because it's sometimes doing these. It's like pulling teeth from somebody to get them to share what they do every day.
Right. Well, I don't think you got to worry about that.
No. And if I can listen to you talk all day, like, you're making it to where it's interesting, but it's not like, you ever had a doctor or anyone talk over your head?
Yes, I have.
You don't do that at all. Like, even like some of the stuff you're saying, it's like, okay, I can follow this.
Right.
Not all of us can keep up
Exactly.
with overeducated people.
And yeah, I've got a master's degree, but I sound like a country hick. I mean, that is just who I am.
It's just an accent.
It's an
just
accent, but I'm an educated hick. Okay.
Yeah.
That being said, we do want to talk at a level where the patient can understand it. I see patients that have no money to patients that are millionaires.
Yeah.
That being said, I'm going to talk to them at the level that I feel that they understand. Sometimes I simplify things even more than I would a normal, just me and you sitting here talking, because some people just don't understand. Or if it's a child that you're, and you're wanting to explain something to, you want to make it in terms where they can understand what's going on.
Yeah, I'm definitely the person you have to speak to like a child.
All right, I'll remember that.
Especially if I don't have like a real adult with me to actually know exactly what you're saying that I have got to take back.
Right.
I'd be like, no, I just, I got a boo-boo. That's what I'll do.
Yeah, Josh, that's a big boo-boo there.
Yeah, that's what they say. Well, I appreciate that so much about you. And I appreciate the fact that when I talk to you about how I have an issue with my weight, that I have an issue maintaining my weight, I will fluctuate 30 pounds in 2 or 3 months. And I know that's not healthy.
No.
I will get down to where I'm super happy. And then I'll be like, I don't want to take any medication. I want to keep eating right. I want to keep playing golf because I don't exercise. I want to do stuff. I want to be active. But then all of a sudden I'll hit this wall, and without taking medication, I will just blow up. And I don't want to be the person that takes medication for the rest of my life. I want to get to where I'm happy. Like Luke Combs said on something not long ago. He said, if I don't get my weight under control before I die, then that'll be the biggest regret of my life. Me, I got up to like 330 pounds a couple years ago. I've been as low as 215. But like growing up, I was always like 195. Then my daughter came when I was 24, and I blew the hell up because I didn't do nothing.
Gotcha.
I didn't do anything. So over the past 5 or 6 years, I've tried to get my weight down.
Right.
and the Adipex don't work for me.
Right.
I mean, I know they work for a lot of people, but I think I took them so long that they just didn't do anything for me anymore.
Correct.
So when I told you that, you started telling me about these other options. You want to kind of tell them about some of these other options?
Yeah, I appreciate you allowing me to do that. Well, first of all, we there's other medications in pill form that we can take. Adipex is not for everybody. If you have a heart condition, obviously, or really uncontrolled blood pressure, that's not happening. So there's other medicines that we can do that orally that we can take. There's the new shots that have been out in the last few years, if you've heard the rage about. We also have our old standard Lipo B, which is
What's Lipo B?
Lipo B is a B complex shot with some other things to help break the fat down and give you energy, control your appetite. So I've had that. That's been my cornerstone of my practice since I started. So that being said, there's multiple things. The newest ones we have are the semaglutide, which is the generic version of Wegovy or Ozempic. It originally started out as a diabetic medication. They found out it worked great for weight, so they reformulated it into the Wegovy. So we have that compounded with B12 in, so it's a semaglutide injection with B12 in it. So, and you take it once a week, and it helps curb your appetite because it slows the stomach emptying down, so that basically you're fuller longer, you're not as hungry. So it helps also your body to use its insulin more effectively and lose weight. So there's, and it's a blood sugar medication. So there's a couple things I always try to make sure that I really teach people how to change their eating habits while we're doing it, and I'll talk about that in a minute. But the other medication is tirzepatide, which is the generic for Mounjaro. We have that in the office as well, and it's also compounded with B12. So basically, the shots are there to, number one, help give you some energy with the B12, help control your appetite, and then help your body break down the fat and in simple layman's terms, help you lose weight.
Okay.
So there are side effects to these medications. I actually have people sign informed consents about them. I explain them in detail. Basically, that the most common side effects of these medications are nausea, diarrhea, constipation, gas, bloating, things like that. That Pepto-Bismol commercial,
I keep Pepto-Bismol on my fat ass. I have to have it everywhere I go.
So that being said, those are some of the side effects. The lower doses, some people do not have any side effects. Some people have them immediately. Some people just can't tolerate them. And that's where the communication is with me and the patients is, or myself and the patient, is that, look, these are the side effects. I even have a printed up sheet that talks about what I preach every day. How you should eat, how much water you should take, exercise, how to deal with the constipation, the nausea, make sure you're taking a good probiotic, which is something everybody should be doing anyway.
I know you're going to get on my ass about this. What is a probiotic? I've heard it all my life, but I don't know what it is.
Well, probiotics are basically the bacteria that's in the gut that are the healthier things that we have a bunch of bacteria. I mean, there is a crap load of bacteria in our gut, but these are the good bacteria. And so they're strains that we know that help the gut stay healthy. So that means if your gut is basically the second largest immune system you have. Your skin is the biggest organ in your immune system, and your gut is the next one. So that being said, these help keep your gut healthy. These medications are great for helping you lose weight, but let's be realistic. We want to make sure that you're doing it, as healthy as possible.
In a healthy way.
And so that's why I try to inform you on about the medication, the side effects, how it works, how it, as well as what you can do to minimize those side effects and help you learn to change your habits. Because we don't want this is not a diet. This is a life-changing experience. That's what I want every patient that comes in here for weight loss or any lifestyle. I mean, I see patients every day for routine primary care things because that's what we are primary care. But every day I'm talking about lean, healthier options, because not everybody, but most everybody in the South is heavy.
Mm-hmm.
We are heavier than we should be. I mean, we don't work on the farms anymore like we used to, and things are automated for us. We sit on the couch in the air conditioner instead of getting out and busting it. So what we used to could eat, we can't do that now, or we can't eat as much. Plus, things are processed. So my whole goal is to teach people healthier lifestyles, healthier options. Exercise is important. You can't take in more calories and expect to lose weight.
Yeah.
You've got to put forth the effort to do the exercise. So if you need to golf 7 days a week, Josh, then you might better get on.
Well, this is what's funny. Everyone that I've dated has been in some way, shape, or form knew something about nutrition, and they've got on my ass every single time because I'm active. I'm not as active as I should be, but when I'd start a process like this, like we're going to start with something today, whatever you pick for me, whatever you think is best for me, I would be like, I'm doing 1,500 calories a day. Like, that's it. I'm eating clean, 1,500 calories, nothing but grilled or baked food, and it's going to be fish, chicken, or steak, or beef, I guess. And I would only eat fruits and vegetables.
Mm-hmm.
Like, that's it. I wouldn't eat anything else.
Right.
But I'd lose a lot of weight real quick because I do that 1,500 calories a day. Mm-hmm. And every one of them were like, you're an idiot. Your body needs more than 1,500 calories a day.
Right.
I don't know where you heard that at, but stop thinking that that's all you need. But I would see results.
Right.
But I think what happened to me every time I do this is I'll get results the wrong way.
Right.
And like, I won't keep it up. I'll just get to a point to where it's like, okay, I'm at my goal weight and I'm eating well. So let me stop taking this.
Right.
But every time, the second you stop, you can't get full. You don't have the energy anymore. There was a time that like I literally would go to the old doctor I would have when I was at the weight I wanted to be, and I was just taking Adipex just for energy.
Mm-hmm.
Like, not really to suppress my appetite anymore. It was because I wasn't eating correctly.
And you were tired.
And I was tired all the time.
Right.
And I told him, and he was like, Adipex isn't supposed to be for energy. They did tell me that. They did say that. But that's about it.
Right. And I get that. And I hear that all the time. And, well, just counseling another patient today, you know, I was like, you know, are we changing our habits? Are you getting rid of the Cokes? Are you getting rid of the Sprite or whatever you're drinking, the teas? Are you switching to unsweet or even the diet drinks? Mm-hmm. Now, I'm not going to advocate that you should be drinking just diet drinks, because I think you should drink a lot of water too.
That's all. I either drink water or beer.
Okay.
That's what I don't drink anything with sugar.
And I tell you, I'll tell my patients that drink the beer, get the nasty lights, and y'all all know what I'm talking about, Natural Light, or Michelob Ultras, and I think there's one other one that's
there's a couple that are 95 calories are right there at it.
Right.
Oh, the Mick Ultra Pure Golds or something.
Yeah,
I think they're 75 calories.
So that being said, I'm like, and you know, and another thing is limit to 2 a day. Don't do 4 or 6 a day. You've got to do everything in moderation. And that's where change in lifestyle occurs. Yeah. Learning to eat smaller portions, learning to eat more frequently but smaller amounts, getting the protein in first. I mean, you obviously want the fruits and vegetables and, you know, and things like that, but that protein is important. And protein consists of anything from meats, like you were talking about, to cheese, eggs, which is, and then of course, your milk's got some protein in it as well, to nuts and things like that. So it's important that you eat small and frequently. The palms of your hand should be about the appropriate size for a piece of protein or a protein snack.
I was wondering where you're going.
Yeah,
I was like, you finna give me a warning sign that I'm about to die by looking at my hand?
No, we're not going to do a palm reading today.
You scared me. I was going to say, I know she's going to see something she's not supposed to in the palm of my hand. I knew something else was going to happen.
I'm not a provider like that. But that being said, your palm size is what you measure your amount of protein with, and even your other vegetables and your fruits. So it's important that you eat small and frequent throughout the day, and that's what I want you to get. And you should be drinking, I recommend 64 ounces of water a day. Some people say at least 1 ounce per every pound or kilogram, I think it is. But that being said, you got to start somewhere.
Yeah.
So if you're only drinking 1 bottle of water a day or none, so the goal is each week add a bottle.
Yeah.
So if you're starting out with 1 bottle a week, then the next week you're gonna go to 2 bottles a day and increase up to 4 to 6 a day bottles of water. That's a lot of water, y'all.
Yeah,
it is.
I don't even get close to that. Like, I think I'm probably 4 or 5 bottles of water a day.
So you're doing good, but you could do a little better. I mean, and I'm saying I'm preaching to the choir here, okay? Me as well. I mean, I have to really concentrate on putting the water in as well. Sometimes I drink it with flavor in it. Sometimes I'll drink it straight. I like well water better than I do city water. Yeah. So that being said, find your water that you like and drink it. If it's Propel,
I love Propel.
Propel's got the flavor in it. There's flavor packs that you can add. The Dollar General, people say it's eating healthy can be very expensive. Well, the dollar store, the Dollar Tree over there, they even have little flavor packs that you can get that have 0 sugar in them that you can add to your water. So if you want some flavor that's relatively cheap, you can get the Mio at the grocery stores. Those work really well. Even Hawaiian Punch has got one of those squeezable things in there you can just put in there. And I like Hawaiian Punch.
Until you just said that, I forgot it existed. And now, it's been so long since I drank a sugar drink. My problem is meats and sides. Mm-hmm. I don't like sweets. It's very rare you'll see me eating a Little Debbie cake or something like that. Ever since Crumble Cookie opened in Warner Robins, now my daughter has took me up there, and I realized what a good cookie was. Oh. I've ate a couple of those.
I gotta stay away from them.
Man, shit, they better quit coming out with delicious flavors.
Exactly.
But switching to water was the only easy thing for me, and it really got to where I read some stuff about this, that once you get the other taste of stuff just where you don't like it anymore, it starts tasting horrible to you. Water is cold water is just so clean and so good, and I crave it sometimes.
Well, that's good.
And now if I go to any place and I just like the old Chinese place up here, I'm so used to back in the day going in there and getting a sweet tea because it used to be so good.
Right.
Now I go in there and it's syrup. It doesn't even feel like it belongs going in my body.
Well, growing up, my grandmother made tea. It was honestly like syrup. I mean, don't get me wrong. That's how we grew up. That's how we drank it. As an adult, I've gotten away from that. I mean, on occasion, I may drink some tea. Mm-hmm. Most of the time when I'm at home, if I do drink tea, it's decaffeinated and it's got stevia in it.
What's stevia?
Stevia is one of the newest sugar alternatives, but it actually is a healthy from a plant, the stevia plant. It's the most natural that we have, so it's safer for you than saccharin and the NutraSweet and the Sweet and Low kind of stuff. So,
okay, I didn't know what that was.
Yeah, so you can buy it at the grocery store, at Walmart or wherever in a pack, just like you can a bag of sugar, and it measures the same for same. You can even cook it with it the same way too.
I didn't know that.
So there's lots of options that you can do.
I like besides for the Propel, I like the 0 sugar Gatorades and Powerades.
Mm-hmm. I do say that those are good options as well. I don't recommend a lot of Gatorade because of the sugar content. And people, when we were growing up, you're sick.
I thought the 0 sugars.
And the zeros are good. That's what I'm saying. They're fine. But if you're sick,
started to scare me. I thought that was they've been tricking my fat ass this whole time.
You're okay. You're okay. They do have the sugar alternatives, so they're not as the best, but I mean they're okay. That being said, when we were growing up, we were sick. Mama gave us Gatorade. Well, your nausea, vomiting, Gatorade's got sugar in it, and it can make it worse.
Oh, okay.
So we want to replace electrolytes, but not necessarily sugar.
Wow, so, I would have never known that.
The Pedialyte, I think they have a sugar-free version of that as well for and I have adults, so we just kind of learn our tricks as we go and on what we.
It just seems like so much stuff that we were told growing up is complete bull.
Yeah,
it's so much.
Eat the whole plate.
Yeah.
You were made to eat the plate.
Oh, absolutely! Look at me. You think I didn't leave a happy plate?
We didn't miss a meal. I mean,
I always laugh when I see the pyramid.
Oh, yeah.
The pyramid that they taught us growing up that was so healthy for us.
Right.
And looking back at it, it's like, they wanted us obese. They wanted us to just be the fattest nation on the planet.
Well, we naturally have evolved into that. Well, McDonald's, just the Happy Meal, the little French fries. Well, have you seen how small the French fries are in the Happy Meal now?
The little bag.
Well, you guess what? That used to be what the size when I was growing up of McDonald's French fries were.
Really?
Or maybe just a little bit bigger, but not much. Now look, they're like huge. They're humongous. Our thing has been that we have progressively increased our portion sizes and the amount of food that we take in. Thus, we're in our sedentary lifestyle, playing video games or or whatever, watching TV, not getting out moving like we used to do, and that's why we're in our processed foods, which made life convenient for us. That's where we're what we are now.
That's crazy.
Yeah.
Do you know the thing? I had to get educated on this, and I might be wrong, so you'd probably be the one to tell me. Do you know the thing on the back of the nutrition labels where it has the daily percentage of everything, and they don't list the daily percentage on sugar on anything?
I believe you are right on that. There is no daily recommended.
Yeah. So like if you don't know what I'm saying, I'll let her explain it better in a second. But if you look on the back of whatever you're drinking or eating right now, it has the daily percentage of how much that item or whatever,
like protein, carbs. But
it never lists. Not a single thing ever lists its sugar.
Right.
That's such.
It's not a recommended daily allowance.
No, there's
of sugar.
not. You're not supposed to be eating that. Like I think. What is it? It's 36 grams of sugar a day is all the body can process or close to it.
Somewhere in that range, yes.
Yeah. When I went on my weight loss journey to start off with, when I was like 330, you could have almost made me a dietitian. Like, and I took things from every single thing that I thought would work for me. It might not work for anybody else,
right?
But I thought it would work for me, and so I put together my own little how I was doing it, and it worked really well. But like I said, I was taking the Adipex, I hit the wall. Boom.
Right.
Like just exploded again. But like, yeah, when I was learning about the sugar, and it's just so bad. Like it's just ridiculous. It's just a filler to make us crave more.
Sugar is actually a toxin to our body.
Yeah.
It really is. So it's just like if you were to give me a poison, sugar is technically a poison. Yeah. But we love it and it's just like we were talking about addiction earlier. Sugar is an addiction just as much as anything else.
It says that it has the same effect on your brain as cocaine.
Yes. Yeah. Yes. Yeah. And the receptors.
It's ridiculous.
I know.
How do you put that in food?
Well, I don't know why or how we originally started doing it, but it's been around a long time.
You don't want to go on that rabbit hole with me. You don't want to go down that. I'm a conspiracy theory nut anyway. I honestly think at some point in time, I think people realized that we were going to become overpopulated, that we had good medicine in the early 1900s or whatever, and that people were going to live longer. Yeah. And we were going to get overpopulated. I think they purposely made us sick. I do. I think. I mean, I'm weird about that stuff though.
I do feel like the industrial ages that we have went through from the early 1900s to where we started processing the food after World War II, like 1940s on, that's where we have changed. And you're right, it may not have been intentionally done, but it has definitely made an impact.
And if it's not that, then it's like these big companies are drug dealers, and they know that if they put sugar in whatever they're selling you, that you're gonna come back and buy it again because you're addicted to
the
it.
Little Debbie's and
it's ridiculous.
The banana splits at the Dairy Queen,
making me
and
hungry now. I ain't
like that.
Heard of a damn banana split in forever.
Well. The other day, I actually treated myself to one, but I only ate about half of it.
What do you stay on a strict diet?
I won't say I stay on a strict diet. I try to.
Did you change your eating lifestyle?
Yeah. Yes. So I was heavier for a good bit of my adult life. I was thin up through school, went to the military, had 2 kids, got out, and then I went to nursing school.
That'll do it too.
I started stress eating, working
I think that's
night
my whole
shift,
life.
Staying awake, to eat to stay awake, So gain weight. And then I decided several years back I had a surgery to lose weight. Well, it did help me lose a lot of weight. But then I started slowly creeping back up again. And I was like, so I've got a picture on my wall hanging beside my desk in there, and I'll be glad to show it to you, that showed me at my heaviest. I will never see that again.
Really?
No.
What did you have? Gastric bypass?
I had a gastric sleeve done.
Okay.
But at this point, I started gaining the weight back because you can stretch your stomach.
I didn't know you could do that
Yes,
afterwards.
you can. You can have a lot of health problems if you don't try to actually eat like you're supposed to and be healthy. So it was a conscious decision that, number one, the heavier I the worse I feel.
Oh, absolutely.
So obviously I've lost, I think I gained about 20 pounds or so, and of my normal weight I've gained probably 20-25 pounds. And I was like, we got to go back the other route. So I did about 10 on my own, and then we started offering the shots here in the office. So, and I actually take the semaglutide. I actually tried Mounjaro when it first came out as a medication, but it made me have blood pressure issues.
Okay.
So that I was like, nope, not going to do that. So I said, well, I'll try the semaglutide in our form that we have here.
So you kind of played around to see what worked best
right,
for you.
Yes. So that being said, I take the shot once a week. I eat better. It helps me to not only stick to what I know is right, it doesn't let me overeat either.
Okay.
So, and the point I'm getting at is, even though I'm preaching to my patients about the weight loss journey, I've experienced it. The Lynn, can't speak for her too much, but I will say this: she was heavier at one point, and she's really passionate about her health and her weight loss program as well, because we've all lived that heavier lifestyle, and we know it's bad on our heart, our knees, our backs.
Well, see, that's what's crazy. When I came off of my Adipex and everything a couple of months ago, I have a friend, and she's a fitness instructor. Shout out to Miss Coach Reagan. Love you, darling. I wanted to do her program. I really did. But the running part of it and the exercising, I know this is going to sound horrible, but like from the years of playing sports and everything, my knees are horrible. My ankle, my shoulder is hanging on by a thread. There's nothing with cartilage or nothing left in it. I can't sleep most nights because of my shoulder.
Right.
And I did everything that I could do with her, and I lost weight, and I looked good, and I felt good. My stamina, everything was good. But I got to hurting so bad.
Right.
And it was where it wasn't just stiffness from exercising. It was, I literally think my meniscus or whatever is fixing to blow in my knee.
Oh, wow.
Like it was the actual pain.
Right.
I lifted weights and stuff in high school and all growing up.
Right.
I know the difference in soreness and pain.
Right.
Like this a pain. So that's where I was like, I just don't think I can ever actually get in the gym and work out like I'm supposed to again. I need to eat right. I need to be active, but I've got to find something to suppress my appetite.
Well, that's a great thing. And even knowing your limits, getting in better physical condition, if you may not be able to bench press or do leg presses or whatever, lift a lot of weights with your, but walking without running, because I have had a torn meniscus. I've had arthroscopy on my right knee, and I still have pain from that from time to time. Both my parents had their knees replaced before they were 50 years old. I mean, I know it's genetics for us. That being said, I was in the military before I became a nurse. And then, of course, all the years of being a nurse on the floor on the hospital, pulling patients and doing this, that, and the other.
Your back has
I'm
to be
not the greatest at exercising either. Now, don't get me wrong. Do I stay physically fit? Yes. To me, I swim. I love to rake the yard. I like productive exercise, okay? I want something to get a benefit out of it. So that being said, I try to do things that I know keep me active, and instead of making a chore out of it, make it more enjoyable, that I see a progress or something. So if my yard looks good, or if I'm clipping the trees, things like that, I do it in moderation.
You're still exercising.
And I'm exercising.
I mean, it's exercise.
And I do try to make sure that I'm walking. Now, could I do better? Oh, yes.
Yeah.
But
all good.
A formal exercise program, some people can tolerate that, some can't.
Well, see, me as a man, that's what you're accustomed to. And then God bless once again Coach Ray, she would even bring not enough weight to where it was 15-pound dumbbells or whatever. I used to do over 100. And that wasn't but a couple years ago. It was
Right.
like less than 10 years ago I was doing that. And as a man, you're just like, I'm not going in a gym and working out with 10-pound dumbbells.
You don't want anybody to see you doing that.
No, you're not fixing to get a video or a picture of me. I'll feel bad. But I know me too, though. I'll get comfortable with 15. I want to move up to 20. I won't be satisfied with that. And then the next thing you know, I can't pick up my arm for 3 days.
Right.
It's gonna hurt me, and it's stupid ego. It's just everything that I can't control about myself.
Yeah, and that's again the moderation part that we talk about. I'm gonna give a real quick plug out to Priscilla and Wesley Dial at Dodge Fitness here in town.
Okay.
They are got a really nice place over there.
Heard nothing but wonderful things about them over there.
They're really good folks, and if you want to go work out, I know we have other gyms in town, but these are locally owned. They live here. They're in there every day, checking on their gym, and basically you have after hours key entry that you can get into. But they can recommend you a personal trainer if you want to do that route and that sort of thing, which is great. Some people need to be taught how to exercise.
Absolutely.
I mean, I'm not an expert in exercise. I mean, I can go in and do the basic stuff, but that's not my expertise. So sometimes it's a good way to getting in the gym, but maybe getting in the right gym may be the right thing for you. Like you said, you didn't want to go in. Well, I don't know what.
Yeah, well, we didn't even. I can't even remember the name of it now. It's changed names a couple of times. But Coach Ray also great personal trainer. Y'all can see her on my social media everywhere. Dodge Fitness. Heard nothing but great things about them. Like it does help if you really. You kind of got to get over that I know it all factor too.
You do.
And you got to be like, I don't. I mean, that's why I'm sitting in front of you now, is because I've done everything that I think I could do, and I've tried everything to where I do want to be healthier. I want to live longer. I want a better quality of life.
And you want to be around for your children and your grandchildren to be grown. You know, you want to enjoy that part of life.
I want to be like a jacked grandpa too, though. Like I want to be like the cool grandpa you see at the beach. He's got the long white beard, still got a couple muscles left. Like, I want to be that way.
Like that eHarmony commercial.
Oh yeah, that dude's so good looking.
It's
like if I can be like that when I get older, why wouldn't I?
Exactly.
What made me wanted to start losing weight back in the day anyway, it wasn't the fact that I was fat. I was fat, but that wasn't it. It was how I felt. And now I get through this threshold to where I feel good for a couple months. I let myself go a little bit, and it's like a light switch almost.
Right.
It's where I go from a comfortable level of health. So the next thing you know is like, I am miserable. Like I don't want to get out of bed.
And here I am again.
Yeah. So like it's where I feel like how you said you have to try. You tried a couple different things with you. I want to try what works for me. I want to try it because I know if I ever get back down that small again, I know everybody damn says this, but if I ever get back, and it's not even about being small, it's about being healthy for me.
Right.
If I ever get back to that comfortable level again, I will do my damnedest. I am never letting it go. And I weighed myself a while ago. I'm not very proud of them. 240. My goal is like just to be around 215, 220.
Right.
I'm not talking about a lot of weight, but that chunk right there it's hard. It's so hard.
25 pounds is a big goal.
Yeah.
I mean, 10, 15 pounds can be a big goal.
Yeah.
Especially like myself, I'm a menopausal woman. We hold it in the middle. The older you get, it's harder for men or women to lose. Men always lose easier than women, first of all, I'll tell you that. But it's like you reach a certain point when you were in your 20s, you could snap it off like that.
Yeah.
But 40 and above, it's not easy to do.
Well, let me ask you, does low testosterone have anything to do with weight gain too?
Low testosterone can definitely help.
Is that something that y'all test for and everything?
Yeah, actually, yes. If I may divulge, when we do your lab work, yes,
absolutely.
I'm going to check testosterone levels.
Good.
Because testosterone needs to be optimized. I mean, after 25, men start losing testosterone, just like after 25, women start losing their elasticity and their collagen. So, so that being said, it's important cardiovascular wise, that you have good healthy testosterone levels in men, as well as women. I mean, you know, we check hormones. We do hormone replacement therapy as well. So that's the whole picture sometimes that you're looking at, not just, well, we're going to do this to lose weight. But sometimes you're stuck no matter what you do. Like I'll have a patient that'll come in and say, well, Lynn, I'm just kind of plateaued. And then I'm saying, okay, what are you doing? What are your habits right now? What have you changed or what have you not done that you were doing? You know, because we slack. Yeah. It takes 21 days to make a actual routine become a pattern and not to be a habit. So it's making yourself do it for that time, and then after that, it supposedly is more naturally that you'll do it. But so we get off track sometimes. Life throws us those curveballs, and run. Our pattern just disappears. So we have to check things out. But low testosterone can definitely make you tireder. It can have on men keep you in the middle more. It affects your sexual lifestyle as well. So it's important.
You just want to give me a testosterone shot while we're here? Well, one reason why I bring that up is men are so taboo about going to get their testosterone checked. And one of the things that I always try to talk to people about, I'm obviously not the most educated person, but I try to look into, like I said, back a couple years ago when I was healthier, I wanted to look into things to make me have everlasting health.
Right.
Like, not eternal health, obviously, but while I'm going to be here, I want to be healthy,
good.
right?
Yeah, I got you.
And I found out that testosterone just is so much centered around the sex drive, the how you hold fat.
Exactly.
All these other things. And I've met so many men that have listened to me say something about getting my testosterone checked.
And that's wonderful.
And they're like, okay, I didn't even know. I didn't even know what was wrong with me. I had somebody explain it to me one time. It was if you had an old car, and if this car had ran so good for so long, but all of a sudden this car just started losing a little bit of horsepower, a little bit of horsepower every other month. It just kept declining.
Right.
And then all of a sudden they went in, got everything just redone. Just everything is all tuned up.
There you go.
And that's what this dude told me. He was like, I went in and I got my testosterone checked and everything got tuned up. And I went back to feeling like I was 18 again as much as I could. So guys, if you're listening, come get your testosterone checked. If you don't get anything else done, if you're feeling just sluggish, sex drive sucks, all this other stuff, there's nothing wrong with getting your testosterone checked.
No, there's nothing wrong with that at all. And if you're over 40, we're going to check that prostate, the PSA level. I'm not necessarily going to stick my finger in places you don't want it.
Please, God, don't.
We're actually going to do the levels. We want to make sure your prostate health is good as well. But that being said, testosterone is such a big, important part in women and men. I do offer the shots. You can do the gel. There's testosterone tablets now that you can take if your insurance pays for it because it is expensive. And I also do the pellets. I do testosterone pellet insertions. That can last anywhere from 3 to 6 months for men. Yeah, insertions.
What do you mean insertions?
Where do you think it goes?
I hope I don't. Ooh.
No.
Okay.
Honestly, it's really something simple. It's a little procedure where I have you lay on your side and I numb the area and I put a little cut. And basically, I put like a straw. I'm going to call it a straw for something simple. That I insert the testosterone into your butt cheek, and then I pull it out, and I just put little steri strips on it. Basically, your body over time absorbs the testosterone.
It just dissolves naturally.
Yes. And that's what you'll get an obvious increase in the testosterone when it's first input, but it lasts longer than the shots, which you're having to give yourself every week or 2 weeks. And hell, who wants to give themselves a shot all the time? I'm sorry, but it's not me.
Yeah, I hope with this weight loss stuff, whatever you decide that we're going to do, I'm coming to you on Fridays or Thursdays or whatever, because there's no way in hell I can give it to myself. None.
Yeah, I mean, I do have a lot of patients do give their own medications, but I'm going to be honest. I don't like needles. I'm a nurse. I'll stick you all day long, but don't you come at me with it, okay?
I can get a tattoo all day long. And tattoos do not affect me whatsoever. There's something about that needle that turns me into a 5-year-old.
I know, it's crazy, and I'm a seasoned professional at it, but I don't like shots. I just don't. I give Rocephin shots, and I know you know what a Rocephin.
What's a Rocephin shot?
It's an antibiotic.
Okay.
And it's a
it seems like I should know what that is.
Yeah, they do not
They give
feel
you that
good.
when you get an STD.
Yeah.
Yeah.
As a matter of fact,
that's how I know.
Can.
That's how I know what a Rocephin shot is.
All right. I see in your chart you did have some.
Whoa, we're not gonna do. Where's that? What's that HIPAA violation?
I know, right?
I ain't signing nothing.
You guys were just joking, but long story short, shots are not something I like to give myself.
Yeah.
So number one, that really incentivizes me to keep my weight down and my sugar down because my dad was diabetic, and we do have a strong family history of diabetes in my family. I ain't giving myself some damn insulin. Not going to happen. Insulin puts weight on you too, by the way, just so you know that. It may control your sugar, but it'll make you gain weight.
I didn't know that.
So no, we're not going that route. So healthier lifestyle, better choices. Again, it's a daily struggle. I mean, I want to go have a snack, and I do succumb to it. Like yesterday, I had my daughter go over to Jack's and get me some French fries. Should I have eaten them? Well, probably not, but I did. But guess what I did last night? I got in the swimming pool and did a couple of laps, to help counter that.
I think that there's a healthy medium, though.
Yeah, you've got to find the medium.
If you're not training to be just like some Olympic swimmer or some professional athlete or whatever, you should not that you shouldn't take it serious the way you eat.
Right.
But you should be like, you know what? I'm going to have a cheat day.
Yeah, you can have a cheat meal.
Yeah,
exactly.
You don't have to be. I think when people think about weight loss and getting in shape, they automatically go to the 10th degree. To the extreme of. You don't have to. You just have to be healthy.
Right.
There's a lot of people that still got a little bit of a gut or whatever.
Right.
And they're extremely healthy.
Exactly.
There's nothing wrong with that.
I mean, and I'm not a marathon runner. I'm not going to ever be one. As a matter of fact, in the study that
I just got tired hearing that.
I know, right? The hormone replacement therapy class that I actually have been doing online for the last earlier part of the year for my certification in that actually teaches that over exercise depletes your hormones.
Really?
It really causes a toll on your body. So there is, again, a moderation to everything, from exercise to eating to all of it. You've got to meet in the middle. And, like you said, we can have a cheat day or a cheat meal. And I do recommend my patients enjoy a meal that they like in moderation. I'm like, if you want to go out and eat, go out and eat. Just remember, maybe do one trip to the buffet instead of 3.
Yeah. Shit, yeah.
But then you got to have a little bit of fun in life too.
Absolutely. So knowing all of what we've talked about now, what would you recommend for me and why?
Okay, well, I think that I would like to actually start you with the terzepatide shot.
Okay.
Again, it's the B12 combination that we've got. And I start out at the lowest dose and work our way up accordingly. So why do I think it would benefit you versus the other one? Well, you don't have a lot of weight to lose, but your lifestyle, the way you are, your eating, your appetite control. I think that it may do a little bit better control for you in the appetite versus the semaglutide. Now, that being said, would the semaglutide be appropriate? Yeah, it would, but maybe the terzepatide would work a little bit better for you. And that's what I try to judge each person, not only by what their issues are, but what, some people can eat or hold their appetite fairly well, but they don't necessarily eat the right things. So, and their sugars are elevated and this, that, and the other. So it's just a kind of a choice that we make together about what works and what doesn't work for the patient. Sometimes it's money. Sometimes it's the frequency they have to come in. So we do give the shots in-house and come in once a week and get them for that don't want to give their own. But we do let patients that are actually established after we've seen how they react to the first dose, they can come back and pick up their, the rest of their shots for the month as long as they're, tolerating it okay.
Yeah, it's not happening.
Well, for you, that's fine. Yeah, we'll be glad to give you yours.
Yeah, there's
no. But for people that that live a little ways, I mean, I see people from Dublin and Swainsboro, and
I think you're worth driving for. Like, in all honesty, everything about this should make somebody who's listening and wanting to come to you for whatever health reason, they should want to come here. Like this, you're worth driving for.
Well, I appreciate that, and I feel like we are. I feel like the whole.
Even your girls the other day were so nice.
Well, good.
Your nurses,
if they're
so
never nice, I need to be told.
They're so nice.
But yeah, we do try. We try our best. I mean, we have our days just like everybody else does. Today was a little crazy. I'm not gonna lie to you. I mean, I saw 21 before lunch.
Ooh.
And that being said, I don't like to do that all the time. But at the same time, when you have patients that are sick that need to be seen, that can't get in their primary care because I wind up getting a lot of patients because I will see patients, and a lot of new patients come to me because I will see them, and their provider says, "Well, you're sick, but it's gonna be 2 weeks before I can see you." Well, that leaves them going to urgent care, and we've got 2 urgent cares here that they're okay if you need them, but their follow-through's not what. That's why you need a primary care.
Yeah.
You need a primary care so that we're going to follow up. We're going to make sure that, hey, did you get over that cold or that whatever it was? Or, is your back feeling better? I'm going to bring you back in. I'm going to follow up with you. I mean, some people don't show back up for their appointments, but if they are sick again, guess what? They'll come back to me. Eventually, I'm going to get them in and win them over. I get a lot of people starting for weight loss, but I wind up keeping them because I take care of them.
Yeah, you got me. I was going to tell you until you kick
Well,
me
that's
out.
awesome.
Yeah,
I'm going to have to run you off with a stick, huh?
Well, I'm going to pitch you an idea to see if you like it, just
Okay.
for the listeners so they can keep up with you. Tell them your social media real fast to start off with.
Okay. Well, you can find us at Your Choice Healthcare or Your Choice McRae. Or you can find me, Lynn NP. Is how I'm on Facebook. And we also have Instagram, TikTok, and what's the other one? Twitter.
Yeah.
We actually.
I don't even have
X
Twitter.
now.
I don't even.
That being said, I don't use that.
I've never used it because they limited you to how many things you could say, and I just always thought that was bullshit. Like if I wanted to say something, I didn't need to be whatever the cap was.
Well,
on
I think Elon Musk has kind of changed that a little bit, and they've changed it to X.
Yeah.
I think is what it's called. I don't really know anything about it, but
I've never.
I mean, I know how to tweet, but I don't do a lot of it, and this, that, and the other. But the point is, watch our Instagram, TikToks, and our Facebook social media, and we do a lot of education. I have a Facebook group that's called Women's Holistic Health and Wellness, and basically we talk about women that are having issues, talking about sleep, appetite, everything, hormones, all of it. We do recipes. We talk about things. I try to keep things interesting. That being said, I actually have a coach that I've worked with over this past year. She's like, don't put very much of your personal stuff on Facebook. And well, I agree with her to a certain extent, but if I'm doing something that I'm proud of, or my family, I want you to see me that I'm approachable. I'm not just somebody else.
My problem with all these people that are life coaches, marketing coaches, whatever, the thing that they miss a lot of the time, and I get why most people would say that. I'm opposite. I think I overshare because I want to be relatable.
Right.
I want to be personable or whatever it is.
Right.
Like I want it to be where if you post something about whatever it is in your life, I want it to be where that is the deciding factor in the why. I'm big on the why. If you've never heard me talk about it, like the reason why I like doing shows like this, I actually love it, is I want to give people a reason why to come to you instead of somebody who does the same thing as you.
Exactly.
And the more familiar they get with you and the more they identify with you, the more they're like, this is my person. Like, this is the person I want to come to.
Right.
So I get why somebody would say that, but putting your personal life out there is what's actually going to draw the people that are going to connect with you.
It does. I mean, that being said, when I first started Facebook was the only social media I had. And that's been almost 7 years ago now. And that's how we got a lot. I mean, I did the radio, I did the newspaper, those all help. Word of mouth. Sometimes just putting a blurb on Facebook about, hey,
Yeah.
gets more attention.
Yeah, because it's personable.
It's personal. And for my patients to realize that, hey, I have my frustrating days too.
Yes, that's
and
exactly
I mean, sometimes
right.
I put a post on there and I'm thinking, oh, wait a minute, I better take it. But sometimes I'll take it down, sometimes I don't. But I have an opinion just like anything else. But basically, I want them to see that I'm human and I'm approachable and that I'm not. Don't be afraid to talk to me, because a lot of times when you go to a provider, they don't talk to you as a person. Yeah. It's just strictly the patient, and that's not what I want you to be. I want you to be my patient, but I want you to be my friend that you can feel comfortable coming and talking to me about what needs to be talked about, whether it's anything from you've lost your spouse to, I can't get it up. Yeah. Kind of thing. That's what we need to be able to talk about. I mean, I want you to feel comfortable talking. And I'm not going to go out on Facebook and spread your information. I hope everybody knows that. We don't do that.
Absolutely not. You could tell.
So, but I want them to be relatable.
That to me really speaks volumes. It does. Like, you just don't, people need, like, I remember, like, growing up and you'd hear about the old country doctor.
That would go to the house.
Would go to the house.
Yep.
I want, when I go to talk to a physician, whatever they are.
Yep.
I want to feel like that. I want to feel like in that 5 minutes that I've got you, that I matter.
Right. And that's what I want you to feel like too.
Yeah, you can feel that with you.
As a provider, I want you to feel like you're important.
Well, I'm just going to step out on a limb here, and I'm going to say that after you doing this, what generic marketing, and when I say generic marketing, is when somebody puts an ad out that just has their business name, their title, or whatever. You never get the why behind it.
Right.
Why go with you? I'm going to step out on a limb and say, of all the people that we've had associated with the show, I think you're going to get a lot of business from this because of how I was not expecting this. I'm a very straight shooter. I was expecting to just get the facts. Like, I was expecting that because that's what you get with some people. They don't know how to connect with an audience.
Right.
They don't know how to connect with their patient or somebody sitting in front of them. They just don't know how to connect. You can connect, and there's somebody out there that has heard how easy it is to talk to you, how whatever. I got a feeling like you're going to get some business from this. And I usually don't say that. I usually don't give false hope to anybody.
Right.
But like, if I feel that way, and I am not the easiest person to get over. Like, I'm not, like I'm so jaded from life or whatever. This is ridiculous. But if I know if I'm sitting here and in the hour and a half we've done this, that I've got a connection with you, there's going to be a woman that reaches out. There's going to be a guy that's got low testosterone or ED or something. And he's like, I feel like I can go talk to this person and not feel like I'm just being judged or anything like that.
And that's what we want. We want you to be able to openly talk to us about whatever situation is going on. And that's the trust that we talked about earlier, the importance of that.
And you're killing it. Like, it, I really. But the idea I was going to pitch you a while ago before we get off here. Now that they have your social media, if we're going to do this weight loss thing, how about for the next couple weeks or months, how long will we do it or whatever till I hit my goal, hopefully. How about we, on your social media and mine, how about we show progress?
Oh, yeah.
Like every week or so, like we'll do some videos or whatever when we get off here in a minute. Like we'll go ahead and get a picture of me now and all this kind of stuff, and we'll show on your social media, and we'll also just like the other stuff that if I have low T or something like that, because I'm very transparent with the people that listen anyway, just the stuff that you've helped me with, and like we can be very transparent. That way other people, especially men, I'm all about men's health and mental health anyway. Like they feel comfortable coming to you.
And that is I do have a lot of men clients that just come see me simply because that they feel like they can talk to me. some of them come because of their wife. Some of them get their wives to come to me because they started coming first. Okay, so that being said, it's a great thing because I don't want one sex or the other to feel like that they're not being heard.
Yeah.
And this being said, if you even have issues with sexuality itself, I'm not. How do I say this? I'm not judgmental.
Yeah.
I'm not going to say that is just wrong. That's not for me to judge.
Yeah.
That's something that everybody has to make.
Still
their
a human being. It's still a person
and
that
that
needs
is
to
what
have.
I say. Look, I don't understand how you feel. I mean, I don't even know if you understand how you feel sometimes. But that being said, I'm here to help you.
Yeah.
To make the best decisions possible.
Well, one of the things that has simplified my life is I'm a Christian. It's not a very good one at times.
We all have those.
Yeah, like I'm just not a very good one. But where it says love thy neighbor, I always simplify it to that for me, that it didn't tell me to love thy neighbor if they were any different than me or not different than me.
Exactly.
Like it just says love thy neighbor.
Yep.
And so like you seem like the type of
If
person that you could come to.
Don't want to treat others as you would want to be treated, then guess what?
Absolutely.
If you want to treat them like crap, that's how you're going to get treated.
Absolutely.
So the point is, do the best you can to take care of people because the people are the heart, and that's where your heart should be when you're taking care of folks.
I hope this practice just gets 1 million more patients because you are wonderful.
Well, I appreciate that. I will say that we are actually getting a new provider coming on board in the Eastman office starting in September. Her name is Morgan Thomas. She is just graduating from NP school.
Okay.
She'll be coming in under my wing and helping me in the Eastman office and maybe in the McRae office in the future. But for now, we will keep her here. And that being said, she is such a sweet young lady as well. She's very approachable, and she's shyer than I am. I'm not shy by any means.
Obviously, I'm glad you're not.
But she is a little bit shyer. But I mean, she's a great provider so far, and I'm looking forward to helping her blossom into where into a great provider as well, and so that she'll learn and grow. And we're just looking forward to the growth of Your Choice Healthcare overall, and also. At some point, we may have to get a bigger building because, I mean, we are busting now.
I know a huge one in Cochrane that's about to be available.
Oh, wow.
As my studio is moving to Macon.
Oh, wow.
Yeah, I don't know if you actually went yesterday, came by, but ours used to be a doctor's office.
I think you had told me that.
Yeah, and
I know where it's at.
Huge.
Yeah.
It is huge.
Wow. Well, if I ever decide to expand the Cochrane way, I can definitely look at that.
Well, do you got anything you want to leave anybody with before we get off here?
Just want to make sure that they understand that it's important to take care of yourself. I'm not saying that you don't take care of others, but make sure that you take a little bit of time every day to take care of yourself mentally, physically, and spiritually, and live the best life that you can.
Absolutely. I love you. I'm telling you, you're going to end up being one of my favorite people, or I'm going to get on your nerves somehow.
Oh, my gosh. It'll be all right. Josh, we'll put up with each other.
Well, thank you. All right, folks. Well, you heard her. You know where to find her. Look her up on social media. Come by the office. Get an appointment now. And just thank each and every one of y'all for listening to the Josh Terry Podcast. We will catch y'all next time.